On to our next exemplar of inflammation, chronic pancreatitis. So chronic pancreatitis is also an inflammation of the pancreas, just like an acute pancreatitis. The difference is chronic pancreatitis causes long-term permanent scarring and damage of the pancreas that makes the pancreas unable to perform its normal duties over the long term. And that includes creating pancreatic enzymes like amylase and lipase, as well as helping to regulate glucose with insulin. Sadly, chronic pancreatitis is diagnosed at a rather young age, between age 30 and 40, more common in men than women, and the most common cause for this is chronic alcoholism. But if you turn on page 1404 of your text, in the upper right corner, box 60.4 lists other common causes of chronic pancreatitis. The signs and symptoms are going to be similar to that you see in acute pancreatitis. It just lasts a lot longer. Things like upper abdominal pain spreading to the back, pain that's worse after eating or drinking, because remember, the pancreas isn't able to produce those digestive enzymes that's going to make normal digestion. Nausea, vomiting, weight loss, diarrhea, pale or clay-colored stools because those pancreatic enzymes aren't mixing with the stool, causing normal coloring. And stratorrhea, which means fatty stools. Again, because the fat is not being broken down by those enzymes. In terms of diagnostics and labs, an abdominal CT or CAT scan may be ordered, or an ultrasound. An ERCP is done under moderate sedation in the GI lab, where the GI doctor puts a scope down the patient's mouth while they're moderately sedated to directly visualize with the camera those ducts in the pancreatic ducts. And also lab studies, again, looking for those lab studies related to the pancreas. Amylase, lipase, and even glucose. Now, just like acute pancreatitis, chronic pancreatitis sufferers will experience extreme pain, and so pain management will be important. IV fluid replacement, especially for patients who are having nausea, vomiting, and diarrhea, they're at risk for having fluid volume deficits. Electrolyte management for the same reason. Remember, if you have frequent vomiting, you're going to be losing sodium. And if you have frequent diarrhea, you're going to be losing potassium. And so you may need to watch those electrolytes, sodium and potassium specifically, and supplement as indicated. Nutritional support in general, especially if these patients are suffering from weight loss because they're anorexic, not eating. Oftentimes, these are chronic alcohol abusers who aren't getting good nutrition for a variety of reasons, one of them being chronic pancreatitis. And good patient teaching about diet is going to be important. Finally, insulin therapy, because the pancreas is not producing insulin that it needs to. And so the patients may need to be given sub-Q insulin as part of their regimen. Now, because the pancreas is not producing those digestive enzymes that are so important for normal digestion, patients may need pancreatic enzyme replacement therapy, also known as PERT. Now, the generic term for that drug is called pancrealipase, and it helps to break down food. It replaces those digestive enzymes that the pancreas would typically produce. And the patient must have these enzymes with their food, not before, not after, but directly when they're consuming the food, so that those enzymes mix with the food that they're digesting. Typically, this is done by opening the capsule and sprinkling it on the food, like applesauce or pudding. We want to encourage the patient to eat that without chewing. We don't want to break those microbeads down any further. And we can expect a reduction in stool for patients who are on pancrealipase. Now, oftentimes for chronic pancreatitis, the ducts are actually scarred shut and occluded or obstructed due to chronic scarring and inflammation. And so sometimes surgeons will go in and do a surgical resection or a Pousteau procedure to actually redirect those bile ducts into the intestines to kind of get around that obstruction. So there are some surgical procedures that are indicated, but they're not appropriate for all patients. All right, let's get into our nursing process as it pertains to chronic pancreatitis. Nursing assessment, let's get into it. We're going to be assessing a pain scale, asking about pain, asking about weight loss, assessing for anorexia, a desire that they're just not hungry. looking for nausea and vomiting, and any problems with bowel elimination, including constipation or diarrhea. Assessment's also going to include assessing for flatulence. Flatulence is the passage of gas. Fatty stools, and we want to look at their labs specifically for those pancreas producing enzymes, amylase, lipase. We're going to look at their serum bilirubin and their alk phos, as the liver enzymes and the pancreas are very closely related. We're also going to look for those elevated blood glucose levels because the pancreas is not producing insulin the way a healthy pancreas would. In terms of nursing diagnoses, some of the problems that we can address as nurses include acute pain, imbalanced nutrition, less than body requirements. Remember, these patients often suffer from anorexia, and also a feeling of hopelessness because this chronic scarring of the pancreas is not reversible. Remember, acute pancreatitis is short-lived and reversible, but chronic is something that the patient's going to suffer from for the rest of their life. Now, in terms of interventions, we're going to be talking about what can we assess, look for specific to a chronic pancreatitis, what can we do, what actions can we take, and what teaching can we do. So in terms of assessments related to this, we're going to take vital signs, we're going to check their blood glucose levels, we're going to look for their amylase and lipase levels, as well as those related liver enzymes like serum bilirubin and alk phos. We're going to also watch their weight and compare it to their baseline, assessing for pain, doing an abdominal assessment, look, listen, and feel, looking at their skin color, and also the quality, the content, the amount, the frequency, and the type of stool that they're passing. Now, in terms of actions to take, we're going to administer those oral pancreatic enzymes that we sprinkle on the food that they take directly with their meal to help aid in digestion. We're going to give GI prophylaxis. Sometimes these patients are going to be on GI medications like proton pump inhibitors or H2 histamine blockers, just to help with those GI upset type symptoms. We're going to provide rest in a calm environment, provide pain relieving measures, whether that means pharmacologic or non-pharmacologic pain relieving measures. And we're going to collaborate with the dietitian to make sure that we're optimizing this patient's nutritional status. And in terms of teaching, we're going to teach our patients to avoid alcohol, to avoid chewing those pancreatic enzymes. They need to swallow those sprinkles whole, to limit fat in their diet as their body's not able to digest fat as a normal pancreas would. Avoid intake of any irritating foods or beverages, and sometimes a food journal can be helpful as patients identify what those triggers are for them. And finally, referral to support groups. Remember that nursing diagnosis of hopelessness, this is a chronic condition that patients will not recover from. There is no cure for this at this time. And so learning to cope with this and have support is an important thing that we need to teach. And finally, we are always going to evaluate, did we make a difference? Did we do a good job? How are we going to know if we did what we needed to do for this patient? Well, we're going to assess their pain management and whether their pain is under control. We're going to look for their weight and make sure that we're minimizing that weight loss, that we're getting their nutritional status back to where it needs to be. And that we're going to see a decrease in those fatty stools, knowing that those digestive enzymes that we're introducing into the patient and helping with their diet in general are making a difference in their gut. And that's what you need to know about chronic pancreatitis. Thanks for listening, and we'll see you in class.